Bismillahirrahmanirrahim. Assalamu alaikum everyone. This is Dr. Mubashra and today I will teach you regarding heart murmurs. Before we start, I recommend you to please use earphones or hands-free in order to listen the sound of murmur in a proper way. Heart murmur is a sound produced by turbulent blood flow within the heart, which is auscultated by putting the stethoscope on the precordium. Normally, the blood flow through the heart is smooth and normal heart sounds are due to closing of the valves, specifically mitral and tricuspid valve. However, if blood flow is not smooth, it is called turbulent flow, that is the disruption of smooth and laminar flow. This is the picture showing pathway of blood, that is blood enters in the right atrium, then in right ventricle, then in pulmonary artery. And after oxygenation, blood will return in the left atrium via pulmonary veins, then in the left ventricle and then in the aorta. This is the picture showing pulmonary valves, tricuspid valve which are present on the right side of the heart and aortic valve and mitral valve on the left side of the heart. Pulmonary valve is present between the pulmonary artery and right ventricle, while the tricuspid valve is present between the right atrium and right ventricle. And the mitral valve is present between left atrium and left ventricle, and aortic valve between left ventricle and aorta. S1, that is the first heart sound, is heard at the beginning of systole and is due to closure of mitral and tricuspid valve. S2, that is the second heart sound, marks the beginning of diastole and is due to closure of aortic and pulmonary valves. S3, that is the third heart sound, is heard in early diastole in rapid ventricular filling phase. And S4, that is the fourth heart sound, is heard in late diastole and in high atrial pressure phase. There are two types of murmur. Number 1, physiological, which are due to some hyperdynamic states, for example anemia, and some murmurs are due to structural defects within the heart. This is the picture showing areas of auscultation on precordium. A1 area or aortic area, which is present in right second intercostal space. Then there is pulmonary area, which is present in left second intercostal space. Then it is Ebstein, that is the A2 area, which is present in left third intercostal space. Tricuspid area is present in left lower sternal border and mitral area is present at the apex in left fifth intercostal space in the mid-clavicular line. Now let's discuss about the features of murmur. In murmurs, we need to focus on 6 very important features. Remember the mnemonic script. S stands for site of murmur, C stands for character of murmur, R stands for radiation of murmur, that is other areas where murmur can be heard. I stands for intensity of murmur based on the grades, which can be heard between grade 1 and grade 6, depends on the loudness of murmur. P stands for pitch of murmur, either low pitch or high pitch, and T is for timing of murmur, that is when in the cardiac cycle murmur is heard, that is systolic, diastolic or continuous. It is important to remember that right-sided murmurs increase with inspiration and left-sided murmurs increase with expiration. Remember the mnemonic RILE. This is the normal heart sound that you just heard, S1 and S2. First heart sound, second heart sound, that is lub-dub. Now let's see that what kind of murmur you will hear in aortic stenosis. In aortic stenosis, the site of murmur is aortic area, that is the A1 area in the right second intercostal space. The character of murmur is crescendo-decrescendo murmur, and it is radiated to the right carotid artery or on the right side of the neck. The intensity is variable but usually it is harsh and it is a high-pitched ejection systolic murmur. Again, hear this murmur of aortic stenosis. The extra features of aortic stenosis include narrow pulse pressure, squatting and Valsalva maneuver makes it louder. Now this is the murmur of aortic regurgitation, which is also known as aortic incompetence. Here blood flows back from aorta into the ventricle during diastole. Aortic regurgitation murmur is best heard at the Ebb's point, that is in the left third intercostal space in the lean forward position. It has blowing decrescendo character. There is usually no radiation, but sometimes Austin Flint murmur is heard, which is a rumbling murmur heard at the apex. Intensity is variable and it is a high-pitched murmur, early diastolic. Again, you heard the murmur of aortic regurgitation. There are some extra features or signs associated with aortic regurgitation, but mostly they are important for theoretical purpose. Like for example, D-Mussett sign, that is head nodding with each heartbeat, Corrigan sign, that is dancing carotids, that is the visible carotid distension and collapse. Water hammer pulse, which is also known as bounding pulse, collapsing pulse. There are certain other signs like Hill sign, Mueller sign, Quincke sign, pistol shot murmur, Dozier sign, which are seen in aortic regurgitation. Mitral stenosis is actually the narrowing of mitral valve, causing increased resistance from left atrium to left ventricle. It is usually due to rheumatic fever. The murmur which you just heard is the murmur of mitral stenosis, that is the mid-diastolic murmur. It is best heard at the apex in the left lateral position. The character of murmur is rough rumbling and there is no typical radiation. It is a low-pitched murmur with variable intensity and mid-diastolic murmur, usually with opening snap. Again, hear this murmur. There are some extra features of mitral stenosis like low volume pulse, irregularly irregular pulse, atrial fibrillation, and malar flush. Now hear the murmur of mitral regurgitation. In mitral regurgitation, blood flows back from left ventricle into the left atrium during systole. The murmur of mitral regurgitation is best heard at the apex. The character is blowing and it is radiated to the left axilla. It is variable in intensity, high-pitched, pan-systolic murmur. And the extra features are that in mitral regurgitation there is good volume pulse. Now this is the murmur of pulmonary stenosis, that is due to narrowing of the pulmonary valve. Here blood flows from right ventricle to pulmonary artery and it is usually congenital and is a feature of tetralogy of Fallot's. It is heard at the pulmonary area in the left second intercostal space. The character is crescendo-decrescendo murmur, harsh in character. There is no radiation, variable in intensity, high-pitched systolic murmur. Then there is murmur of pulmonary regurgitation, which is due to insufficient pulmonary valve, which leaks blood from pulmonary artery to right ventricle. It is rare and is usually due to pulmonary hypertension, and then it is called as Graham-Steele murmur. It is best heard in the pulmonary area, decrescendo in character, typically no radiation, variable intensity, high-pitched, early diastolic murmur. This is the murmur of atrial septal defect. It is best heard in left sternal border, crescendo, decrescendo in character, typically no radiation, variable in intensity, high-pitched systolic murmur. The sound that you just heard is the wide fixed splitting of second heart sound, which is an important extra feature of atrial septal defect. This is the murmur that you heard is pansystolic murmur seen in ventricular septal defect. This murmur is heard at left lower sternal border, hollow systolic, typically no radiation, variable intensity, high-pitched pansystolic murmur. This is the murmur of patent ductus arteriosus. It is best heard below the left clavicle. It is machinery-like murmur, continuous murmur, with no radiation, variable in intensity, high-pitched, hollow systolic murmur. This is the sound that you just heard is S3 gallop rhythm or third heart sound. And what kind of sound you will hear in S4? This is S4, which is typically seen in heart failure. There are other murmurs as well, like for example tricuspid stenosis, that is because of the narrowing of tricuspid valve, but it is rare and it is usually present along with tricuspid regurgitation or in carcinoid syndrome. It is best heard in the tricuspid area. It has rumbling sound or scratching sound with no radiation, variable intensity, and usually low-pitched mid-diastolic murmur. The extra features are raised JVP, congestive hepatomegaly, etc. And tricuspid regurgitation, which is because of insufficient tricuspid valve which leaks blood from right ventricle to right atrium. And the best site is tricuspid valve with no radiation, variable in intensity, high-pitched pansystolic murmur. Tricuspid regurgitation is present in Ebstein anomaly, in which there is raised JVP and hepatic pulsations present, and it becomes louder with inspiration, and this is known as Carvello's sign. Thank you so much for watching. Stay blessed. Allah Hafiz.